Hello, my name is Debbie Reynolds. They call me the Data Diva. Today, I want to talk about data privacy and the Health, Infrastructure, Security, and Accountability Act. So, the Infrastructure, Security, and Accountability Act is a bill that is proposed by Senators Wyden and Warner, and this is as a result of the 2024 United Healthcare cyber attack. This is a massive system wide attack where, for example, people had trouble getting, for example, surgeries. They had problems getting medication. They had problems verifying not only their insurance, but maybe providers getting paid and things like that. So it caused a huge upheaval in the US on the healthcare front. And what these senators want to do is to try to create more accountability in infrastructure in systematic or systemic systems or problems that happen in data systems as it relates to data of patients. So, what they're proposing is mandatory minimum cybersecurity standards for providers, plans, clearinghouses, and any associates that are involved anywhere in the healthcare supply chain. So this is a big deal. I know up to this point, HIPAA is very stringent in terms of healthcare portability, and actually, this is a very unique U.S. problem because the U.S. doesn't have universal healthcare. A lot of this data exchanges that happen and have to happen sort of raises the risk of data problems because, for example, if you change jobs, you may be changing insurance. If you change doctors, you may change insurance. So there's a lot of data exchanges that happen. If you're getting a prescription, if your insurance pays for a certain amount of it, there's a lot of data exchange that happens as a result of all the types of things that have to happen in these systems. Because this was such a massive attack, the senators are concerned about the supply chain and the infrastructure in healthcare systems and making sure that there is some type of base level understanding of what cybersecurity measures should be put in place so that people's data isn't subject as much to damage in a particular cyber attack. They also want to remove the HIPAA fine caps to increase accountability for these types of systemic problems. They want to increase funding and support for hospitals and medical systems that need help to be better in cybersecurity. So, funding them so that they have better cybersecurity infrastructure. Also, they're going to be supporting HSS, Health and Human Services, for mandatory cybersecurity standards so that they can manage that and create more increased accountability in healthcare. I think this is definitely the way of the future as opposed to having, a law like HIPAA where it's just really around the individual. They want to create more um, regulation around infrastructure and how the different pieces of infrastructure work and how that type of security is handled. From a privacy perspective, I think this is a good move forward. There should be basic mandatory cybersecurity standards, not, in my view, not just for healthcare, but for all types of businesses. But because healthcare is so important to our infrastructure and to our security as a nation, I think that they feel that this type of bill or this type of act will create at least some baseline understanding of cybersecurity and the obligations of anyone in the health supply chain and be able to help them reach those goals with whatever funding or whatever knowledge sharing that's required to be able to help them do a better job in that area. That's it. Thank you.